An usually tall, sorry, unusually tall 43 years old lady presented with surgical clinic with bilateral inguinal hernia. She developed chest pain and collapse. As a part of her investigation, X-ray shows evidence of the mediastinal widening. What is the most likely diagnosis? That means a patient suddenly present with chest pain and collapse, and on X-ray there is mediastinal widening. So these two are the most key point. And another point is unusually tall. We know some different disease or some specific disease, the patient become very long. And they are also the bilateral inguinal hernia. That means there is the connective tissue disorder, because in case of female, in case of lady, usually inguinal hernia is not common as the male person. So in female, inguinal hernia bilateral, that means there is the collagen vascular disease present. So what may be their answering option? They have the pulmonary embolus, aortic dissection, Tige syndrome, Boerhaave syndrome, myocardial infarction. So what may be the cause? First of all, let's say the aortic dissection. Let's detail about the aortic dissection. Aortic dissection, it is the more common than rupture of the abdominal aorta. That means the aortic dissection, from the dissection, rupture is very common. 33% patient die within past 24 hours. So a huge amount of patient die in case of the aortic dissection, rupture following aortic dissection. 50% die within 48 hours if no treatment received, and it is associated with hypertension. And again, here we can see the feature of the aortic dissection. It is the tear of the intimal layer followed by formation and propagation of the subintimal hematoma, which is the cystic median necrosis. And here we can see in case of Marfan syndrome. So in case of the Marfan syndrome, aortic dissection is very common. And we know in case of the Marfan syndrome, there is very tall. So, and in this question, the female is very tall. Most common site of dissection, 90% occur within the 10 centimeter of the aortic valve. That means the proximal aortic dissection is very common. Proximal aortic dissection is very common, then distal. Here we can see a picture. This is the heart, and we see here, this is the aorta, and ascending aorta, arch of aorta, and descending thoracic aorta. And here it is very visible that there is the tear in the intima. We know the blood vessel, it contains 3 layers: tunica adventitia, tunica media, and tunica intima. In case of aortic dissection, what happened? This intima layer tearing, and the blood goes a space which lies between the tunica media and tunica intima. So blood goes to tunica media and intima, and it propagate and it dissect downward. So this is the ultimate fate, and it is the grave complications. So what happened? The intimal layer of the blood vessel torn, and then blood entered the space between the tunica intima and tunica media. And now see the Stanford classification of the aortic dissection, type A and type B. And here we can see the location. In case of Stanford classification, type A, it is located, that means when aortic dissection occurs, ascending aorta and aortic root. And type B, it occurs in the descending aorta. And in case of the type A, that means the proximal aortic dissection, their surgery is the only option. That means the aortic root replacement. And in case of the distal aortic dissection, that means type B, which is the descending path, in this condition medical therapy with the antihypertensive is enough for treatment. So in case of type B, no surgery. In case of type A, surgery. And DeBakey classification, another classification, which is the DeBakey classification, and it is divided into 3 parts: type 1, 2, and type 3. In case of the type 1, it affects ascending aorta, arch of aorta, and descending aorta. That means whole part of the aorta is involved. And in case of the type 2, ascending aorta only. And in case of the type 3, it is the descending aorta distal to the left subclavian artery. That means the type 2 and type 3, actually it is the Stanford classification A and Stanford classification B. Now see in this picture the Stanford classification A and Stanford classification B. In case of Stanford classification A, here we can see the proximal part mainly affected, and in case of the B, it is the distal part affected. And here we can see there is the first of all the aortic dissection, then blood enters the space between tunica, intima and media, and finally what happens, and finally it may get rupture. Now the clinical feature, what are the clinical feature? Clinical feature is the tearing, sudden onset chest pain. So sudden onset chest pain, hypertension or hypotension, and the neurological deficit. These are the clinical feature of the aortic dissection. Actually the most important clinical feature is the collapse. So when there is collapse, in this condition the diagnosis goes in favor of the aortic dissection or aortic aneurysm rupture. So aortic dissection rupture or aortic aneurysm rupture, these are the clinical feature for this collapse. So collapse is the most important point. Now investigation, what is the investigation? First of all, X-ray test, and the X-ray test shows the widened mediastinum. So widened mediastinum, it is a feature of the aortic dissection. Also there may be abnormal aortic knob, ring sign, and deviation of the trachea or esophagus. CT angiography, in case of CT angiography it will be more visible. MR angiography is another option, and conventional angiography is another option, but conventional angiography is not used because CT angiography, MR angiography is now very available. So what is our answer? I think it is very clear now that patient present with chest pain with collapse. That means when there is collapse, think for aortic aneurysm rupture or aortic dissection rupture. So direct think for aortic aneurysm rupture or aortic dissection rupture when there is chest pain associated with collapse. And here we can see this chest X-ray, it shows the mediastinal widening. It is another feature of the aortic dissection. And here we can see the unusually tall. This unusually tall, that means it is a disease. The lady suffering from a disease, and this disease is the aortic dissection. Sorry, this disease is the Marfan syndrome. Actually the lady suffering from the Marfan syndrome, and in case of the Marfan syndrome there are also the connective tissue disorder. So in this condition bilateral inguinal hernia present. In case of female, usually inguinal hernia not common like men, and as it is bilateral, that means there is sure a connective tissue disorder present. So all this summary actually goes in favor of the aortic dissection. Other options here such as the pulmonary embolism. In case of the pulmonary embolism, there should be a background, that means the venous thrombosis present, or there should be post after delivery, that means amniotic fluid embolism. There should be other history like the fat embolism, like the fracture or road traffic injury. So there is previous history present in case of the development of the pulmonary embolism. And Tis syndrome, what is Tis syndrome? It is actually the pain in the upper part of the thorax. Actually it is the costochondritis of the upper cartilage. Then Boerhaave syndrome, in case of the Boerhaave syndrome, actually Boerhaave syndrome is the perforation of the esophagus. So in case of the perforation of the esophagus, the clinical symptom is totally different. And the last of all, myocardial infarction. In case of the myocardial infarction, there is sudden severe pain but no other feature present.